Hi, my name is Michele Ardolino and I'm a scientist at the OHRI and an assistant professor at the University of Ottawa.
I'm Jonathan Hodgins. I'm a graduate student in the Ardolino Lab.
And one of the focus of my lab is trying to understand the immune response to prostate cancer and try to use the power of the immune system to fight this horrible disease. There are many kinds of immunotherapy. And one immunotherapy in particular that we are developing here at the OHRI is oncolytic virotherapy. Healthy cells are usually very good in fighting viruses, and viral infection is very challenging in a normal cell. However, during cellular transformation which lead to cancer, healthy cells lose the ability of fighting viruses, and therefore, when we expose healthy cells and tumor cells to a viral preparation, the virus will most selectively infect the tumor cells rather than the healthy cells. As a result of increased susceptibility to viruses, researchers at UHRI have developed a new immunotherapeutic platform based on the injection of these oncolytic viruses, which will selectively target. When cancer cells are infected with an oncolytic virus, the virus will eventually kill them, and in the process of dying, the cancer cells are also able to activate the immune response, and therefore oncolytic virotherapy will also lead to an increased response against the tumor. Prostate cancer is a prime candidate for oncolytic virotherapy. Preclinical studies and clinical trials have shown that oncolytic virotherapy is very effective in prostatic cancer patients. However, not 100% of the patients show a complete response or signs of a durable response. But we still don't know why this is the case. We still don't know why some patients are able to respond to oncolytic viruses, whereas some other patients are more resistant to this virotherapy. Understanding the molecular basis which lead to resistance of some tumors, prostatic tumors, to oncolytic virotherapy will give us a better idea on how to intervene to make these tumors susceptible to the treatment.
In our lab, we hope to understand why certain prostate cancer cells are more resistant to oncolytic virus infection, while others are very susceptible to this infection. In particular, our work so far, supported by Ride4Dad, has shown that when you infect some of these prostate cancer cells, they can very easily be infected and killed, while others that are missing key proteins, cellular proteins, they are less susceptible to oncolytic virus infection. As Michele mentioned, in trials so far, there's been quite a diverse response of patients to oncolytic virus treatment, particularly in prostate cancer. And so we hope that our work will lead to a good biomarker to identify which patients will well respond to this therapy, while others who don't won't receive this unnecessary therapy. By understanding the molecular mechanisms that mediate oncolytic virus efficacy, we hope to identify new druggable targets that will hopefully lead to new treatments for prostate cancer patients. The support from Ride4Dad is essential to our work and development of all new therapies, and also to the understanding of prostate cancer in general, such that we can develop these new therapies and hopefully reduce the burden of this terrible disease.
Thank you!